When a patient is told their cholesterol is elevated, the reflex response is often to prescribe a statin. But there is a more important question we should be asking first. Why is the cholesterol elevated in the first place? Because cholesterol is not just a number, it's part of a much larger metabolic system. In both men and women, elevated LDL and triglycerides are often downstream markers of metabolic dysfunction, particularly insulin resistance. When insulin signaling becomes impaired, the liver increases production of VLDL particles, triglycerides rise, HDL falls, and LDL particles become smaller and more atherogenic. At the same time, skeletal muscle, your largest metabolic organ, is no longer efficiently taking up glucose, in part due to impaired GLUT4 activity. So instead of asking, how do we lower LDL, we should be asking, how do we restore normal physiology? Let's start with the most powerful intervention, skeletal muscle. Exercise, especially resistance training and high-intensity interval training, improves insulin sensitivity and activates GLUT4 independent of insulin. That means you are restoring glucose uptake at the cellular level. Next is nutrition. Reducing refined carbohydrates and excess sugars lowers insulin demand. Increasing healthy fats, particularly omega-3 fatty acids, can reduce triglycerides and improve lipid metabolism. Dietary patterns like the Mediterranean diet have strong evidence for reducing cardiovascular risk in both men and women. Then we look at visceral fat, which is hormonally active tissue that drives inflammation and insulin resistance. Reducing central adiposity has a direct and meaningful impact on lipid profiles. Now let's talk about hormones, because this applies to both sexes. In men, low testosterone is associated with increased visceral fat, insulin resistance, and unfavorable lipid patterns. In women, particularly during and after menopause, declining estrogen levels are associated with increased central fat distribution, worsening insulin sensitivity, and rising LDL cholesterol. So in both men and women, hormonal imbalance can be a driver of metabolic dysfunction. And when appropriate, thoughtful hormone optimization may improve body composition and metabolic health.